By a one-vote margin this afternoon, the state's Trauma Advisory Committee voted to allow some trauma care to return to Central Maine Medical Center. Earlier this month, CMMC said it would stop doing trauma surgeries, specifically neurosurgical services. News Center Maine's Jackie Mundry explains the committee's decision today.
Up until this month, Central Maine Medical Center was considered a level 2 trauma center,
which means that they had the capacity to provide neurosurgical coverage 24 hours a day.
But when the hospital announced it could not provide neurosurgical services, that meant smaller hospitals in the region wouldn't be able to divert trauma patients to CMMC.
When a small hospital that has no capability to take care of a particular trauma patient asks another hospital that has that capability, obviously a trauma center, be that level 1, 2, or 3, and they decide that they have that capability, they should be able to accept that patient.
In a 10-9 vote, the Maine Trauma Advisory Committee has decided to allow CMMC to accept some diverted patients, meaning someone who doesn't have any neurosurgical needs, but might be in need of something like orthopedic surgical services. But the committee says this isn't the end of the conversation.
We expect continued discussions about our trauma system and continued evolution of our current trauma plan.
The committee will continue to keep an eye on how this new plan is working and revise as necessary. Jackie Mundry, News Center, Maine.
And state health officials want to make sure that people know they can and should still go to their closest hospital if they are in need. The doctors and others there will figure out if you need to go somewhere else for your injuries.